Adolescence is a really important time for personal development. It's a time when mental health difficulties can often arise for the first time for young people.
And these difficulties, they can be treatable, and most young people make a very good recovery. Mental health difficulties are often caused by a mix of our genetics and biology, environments and social factors. They can be triggered by stressful life events such as bullying or family separation.
The most common difficulties that we would encounter for adolescents tend to be anxiety, depression, panic disorder, eating disorders, and bipolar disorder. Less commonly, there can be early onset psychosis. There's a certain level of anxiety and low mood that is within the normal range. So everybody might experience dips in their mood during the day, or if they have a difficult period in their lives. But for those who tend to seek help from mental health services, there tend to be more of an impact in their functioning. So they might be struggling to get to school or to engage with their peers.
Going through a mental health difficulty can change how we feel and think and act, and it can affect our personal and social lives. Some signs of a mental health difficulty include a change in behaviour, a recent drop in performance, or new behaviour problems in school. People can experience fatigue or changes in sleep patterns, and a loss of enjoyment in activities that they previously would have enjoyed. There can be self-harming behaviours and social isolation, and a loss of attention to appearance. There can be extreme sensitivity to rejection or failure and suicidal thoughts. With the right help, most young people will recover and return to a normal, fulfilling life. Treatment can take different forms and can involve education about your mental health, talking therapies, growing awareness around sleep hygiene, eating well, building confidence and self-esteem, and developing coping skills.
You may also be recommended to take medication to ease your symptoms and support your recovery. Some teenagers might need group therapy or intensive inpatient care. The knowledge and skills that you learn through mental health treatment and recovery are skills for life.
It can sometimes be hard for young people and their parents to recognise signs of a mental health difficulty.
Young people, when they're struggling with their mental health, should seek help as soon as possible. Sometimes that might just be someone that you trust, like a friend, an adult friend ideally, or a family member or a teacher, and going to somebody that you know and trust and letting them know that you're struggling with something is the first step. And then later down the line, maybe seeing your GP if you think that might be helpful as well. If you have questions about young people's mental health, you should visit the Walk in My Shoes website, walkinmyshoes.ie, or contact the Support and Information Service from St. Patrick's Mental Health Services.